The topic is exploring the hidden epidemic of medical negligence in Sri Lanka. Hope we don't have any media up here. By Dr. Suganthika Devi, Senior Registrar in Internal Medicine, National Hospital, Galle. So, Suganthika Devi, she is a Senior Registrar in Internal Medicine, attached to National Hospital, Galle. She had her MBBS at SRM University, India, and received her MD in Internal Medicine from the Postgraduate Institute of Medicine. So, over to you, Suganthika.
Very good afternoon to everyone. As a medical professional, our primary duty is to safeguard the patient's rights, also give them effective treatment. Medical malpractice, unfortunately, challenges this fundamental basic. It not only has a profound implication on the outcome of a treatment, but also erodes the patient-doctor relationship and opens an era for medical legal battles. So today I would like to discuss the ethical and legal implications of medical malpractices with a focus on preventing their occurrences in our profession. By definition, medical negligence is a breach of duty of care towards a patient by an act of omission or commission, resulting in harm, injury, or death of a patient. So when we consider the world statistics, even the most well-developed countries have a significant number of medical lawsuits filed annually, leading with Australia, Sweden, and United States of America recording 21% of medical lawsuits for the last year, followed by Switzerland and United Kingdom. The NHS UK has spent about £2.8 million to settle these negligent claims for just 1 year, 2023 to 24, and 81% of these cases were settled out of court. When we go through the documentation, we see that most of these malpractices errors were documented in emergency department, with recording 1,400 cases for 1 year, 2024 alone, followed by obstetric, orthopedic surgery, and general surgery. In United States, medical malpractices are the third leading cause of death, just behind cancer and cardiovascular diseases. Last year, they had recorded about 251 deaths, which is 9.5% of total death. An interesting observation by the American Medical Association is that 1 in 3 clinicians practicing in US will be sued for medical malpractice during their career. And another few interesting findings I found out going through their data is that females more than 40 years are more likely to file medical malpractices, with male physicians being sued higher than the female physicians. The reason I could not find out why. What about Sri Lankan data? Do we have any national data, local data to say that the prevalence of medical malpractices in Sri Lanka? Unfortunately, no. Though the government is trying to develop some data collection, this has not come into practice, and there are no published data with respect to Sri Lankan statistics. So when you say there is a medical negligence act, there are 4 main criteria that needs to be met if somebody is going to file a medical lawsuit, negligent lawsuit. First, a duty of care should be established between the patient and the doctor. Second, breach of duty should be there by an act of omission or commission. As a result, causing damage, harm, or death of patient. And a causal relationship should exist between the breach of duty and the harm caused to the patient. As duty of care, as healthcare professionals, we all owe a duty of care towards the safety and well-being of the patient. This doesn't stop with admission, treatment, and discharge. It goes way beyond that. We are responsible for any complication that develops as a part of the disease that we are treating or the complications of the medications and treatment, and also includes the advices that we give for follow-up of these patients. According to the Sri Lankan laws, Ministry of Health and its staff are considered as government servants. Since doctors have an agreement with the DGHs to treat all patients who enter the state hospital, it is emphasized that we all have a duty of care towards the patient, whether we like them or not. Breach of duty is determined when determining the breach of duty, first we need to have a standard of care. The standard of care is what a reasonably competent health professional would have done in the same situation. And the standard of care is not what we routinely practice in the wards. This is set by the code. To give a small example, we know the nurses give the drugs at 8 a.m., 2 p.m., and 8 p.m. This is just before or after their shift changes. But if a patient has to get a drug at 6 p.m. and it has been delayed and given at 8 p.m., the patient can still sue the health professionals, claiming that there was a breach of duty in giving us medications. Injury and damage, it has a very broad spectrum. It includes physical injury, damage and disfigurement, pain, mental pain and suffering, financial loss, and including death. And it's a case-based case assessment, and it varies with the circumstances. Causation, to claim, to say that there is a medical negligence, this is a very important criteria to be met. That is, even if the healthcare professional has a duty of care and there is a breach of duty and a damage done, the harm needs to be directly linked to the breach of duty. If this link cannot be established, that is, the breach of duty is what caused the damage to the patient, then the health professional is not liable for the negligent. What are the common causes of medical negligence? Going through the Western data, 80% of cases are due to misdiagnosis or wrong diagnosis. 2022 to 23, Australia has recorded 140,000 medical errors, and that has been taken up in the lawsuits as well. So misdiagnosis and wrong diagnosis constitute a major portion, and treating based on those wrong diagnosis constitutes a medical negligence. Surgical errors. We would have all heard about cases where wrong patient, wrong limb amputated, wrong side biopsy. So these are some of the very simple cases which could have been avoided. Anesthesia errors. An anesthetist's job is just not to give the anesthesia. He should have taken the proper history himself, gone through the patient's drug and medication records, because some drugs can interfere with the dosage and route of administration of anesthesia. So if the patient has injury as a result of anesthesia and his medication interference, the doctor can be sued for medical negligence. Prescription errors. We see in a day-to-day practice, wrong drug, wrong dose, wrong duration, drug given despite the patient having a history of allergy. These are very important, 100% avoidable errors. Failing to treat patient in timely manner. To give an example, in emergency unit, if you don't recognize an anaphylactic shock and there is a delay in giving adrenaline and patient dies because of that, that is a criminal negligence. And failure to follow up with treatment. As I said previously, the treatment shouldn't just stop on discharge. You should follow up the patient and see what's happening to the patient. Lack of informed consent. We all take consent for lumbar puncture and line insertions, but are they properly informed consent? How many of these patients know the procedure, how it is done? Is it under anesthesia or is it under local sedation? So none of these are known to the patient. I had spoken to my own ward patients and realized that there is a big communication gap between the doctors and the patient themselves. So get the consent. Informed consent is very important. And communication, we all, in day-to-day clinical practice, we all lack that. Not because we don't want to do it. We do have reasons, but those reasons cannot be accepted in the court of law. What are the regulatory bodies in Sri Lanka? If there is a medical negligence act, there can be a case complaint made to the health authorities, and an affidavit can be forwarded to the Sri Lankan Medical Council. Then the Ministry of Health appoints a committee with relevant expertise. And if this negligence is proven, the Public Service Commission can take disciplinary action against the doctor. But none of these internal inquiries and punishments compensates for the victim. So the victim still has the right to file a case with the Human Rights Commission, go for a police case, or file a civil case with the district court. How many of us have seen this form in the world? This is an adverse event or incident reporting form, the health form 1259. It is available in all the wards. Mostly these recordings are done by the nursing in charge. So whenever there is a problem in the ward, it includes under whose supervision this adverse event occurred, what happened to the patient, what was the outcome of this adverse event, did the patient have disability, did he recover completely, or was there a death of the patient? And it includes multiple causes. Although this list doesn't compromise everything, we have to update this form if we want to improve our health system. The legal framework we work in, patient can file a civil negligence or a criminal negligence case, and a disciplinary action can be taken. And more importantly, it causes a significant reputational damage to the doctor or any health professional. Civil negligence cases generally filed for minor cases like mild physical damage or mental suffering. We still operate on the Dutch Roman law, where this cases under the civil negligence are compensated with monetary value. Criminal negligence cases are pursued when there is a more severe injury like loss of limb or death of the patient. Section 328 and 329 of Sri Lankan Penal Code gives imprisonment ranging from 6 months to 2 years along with a fine. This depends on how well your lawyer can argue and get the punishment reduced. So let's go through some of the interesting case studies in Sri Lanka. This is a case, landmark and controversial medical malpractice case in Sri Lanka, which happened in early 90s, where the plaintiff, who was a famous lawyer in Colombo, his daughter of 8 years had involuntary movement of hand. So he consulted one of the more prominent consultant pediatrician in Colombo, and the child was diagnosed with rheumatic chorea. Despite treatment, since there was no improvement in the involuntary movement, the lawyer took the child to another consultant whose initial diagnosis was rheumatic chorea again. But 2 days after treatment, since there was no improvement in the symptoms, he wanted to do a CT brain, which showed a brainstem glioma. So case was initiated in the lower district court, where the plaintiff, the lawyer, argued that if the diagnosis of brainstem glioma was given earlier, the child would have survived a little more longer. We all know that brainstem glioma has a very poor prognosis, and there wasn't any treatment, definitely not in the early 90s. So although the initial verdict was towards the lawyer saying, and there was a huge fine imposed on the consultant, the case was appealed and it went up to the Supreme Court, where the Supreme Court ruled that even though there was a misdiagnosis of brainstem glioma, even though there was a misdiagnosis of rheumatic chorea, the actual diagnosis wouldn't have prevented the death. So there was no direct causation given by the plaintiff to say that it was a wrong diagnosis that caused the death of the patient. And so the final verdict from the Supreme Court was with the consultant pediatrician. Another case in 2022, recent case in District Hospital Gampa, where a mother was admitted with labor pains. Despite her complaint, there was no action taken, and this later led to emergency cesarean, where there was a cord. The child was found with cord around the neck, and the baby suffered permanent brain damage and living with permanent disability. The court found that there were multiple shortcomings from the health professional side. There was a failure to conduct a timely CTG. There was a delay in arranging emergency section, and the conduct of the staff towards the plaintiff was also considered in giving the verdict. So as a result, a specialist evidence was taken who admitted that the disability of the child wouldn't have occurred if the hospital staff had exercised their due care. And finally, the plaintiff was awarded $3 million in negligence. This case is still being appealed in the higher courts. In 2012, a 30-year-old mother died at private hospital Mathura after receiving a wrong injection. Going through the records, there wasn't an indication to give the injection in the first place. Another case from Nigama-based hospital, a lady, 45-year-old lady died after receiving wrong blood type, wrong mismatched blood transfusion. Let's consider, going through the previous cases locally itself, we know 100% that these death or injury shouldn't have occurred if there was proper duty of care is given to the patients. So let's see some international malpractices. The famous Michael Jackson and Dr. Murray, who was sentenced to 4 years in imprisonment and fined $100 million. He was found guilty of involuntary manslaughter for administering propofol to treat Mr. Jackson's insomnia, and without getting a properly informed consent. And he had administered propofol without having necessary equipment for monitoring. The court also found that there was a delay in conducting effective resuscitation efforts and delay in contacting the medical services. This is a very old case, but I think it is very important for us to learn this case as well. In 1985, a famous photographer was diagnosed with corneal cancer. As a good gesture, he donated his eye to medical school for teaching purpose. So therefore, a vial of formaldehyde was brought to the operation theater, and it was in an unmarked vial. During the procedure, the surgeon had to remove CSF and re-inject it back into the spine. But instead of injecting the CSF back into the spine, by mistake, the surgeon had injected formaldehyde. And this rendered him brain dead, and he ultimately died. An autopsy revealed that the solution has turned his organ to stone. So this catastrophe resulted in policy change where no unmarked vial should ever be brought to the OR. How can we prevent medical negligence? Proper documentation. The BHDs and your prescriptions will speak for itself in the court of law. So proper history, examination findings, your investigations and the findings of the investigations, your follow-up plan, everything should be there in the BHDs or your prescription. Communicate with the patient and family. Let them know what you're thinking. So when you have a good rapport with the patient, it's easy to communicate, and especially if something goes wrong, they are more likely to accept the mistake. Update your knowledge and skills. What we practiced in 90s, 80s, and early 90s are quite updated now. We have updated clinical trials, clinical management, imaging modalities. So all of this will help in better management of patients. So it is very important to update your knowledge with latest clinical trials and management strategies. Follow ethical principle. If patient is not happy with the treatment, document that, and it is better to avoid that treatment rather than patient having a consequence of the treatment and later filing a lawsuit. Ideas on local legal laws. What we consider as legal in Sri Lanka may not be legal in when we go for foreign training. So always be aware of what is ethical and legal in foreign countries and locally as well. Conduct clinical audit. This isn't to point out anybody's mistake. We all learn from our own mistakes and others' mistakes. So conducting such audits will improve our healthcare delivery to our patients. So what are the rights and defenses we can use from our side in the court of law? Generally, there will be no negligence. No negligence will apply if you all follow the standard care protocol. A right to fair trial. We all know when there is some problem with patients and the hospital staff, the media covers only the patient side. So the other side of story is not heard, it's not known to the public. So we all need a fair trial to prove our innocence. Patient's non-compliance. Whenever we get a patient and we write the history, we should always document if the advices given previously had been followed up or not. Surplus of patients, shortage of medical staff and equipment. Although you can give these reasons in the court of law, it's up to the court whether it is going to accept it or not. And no fault system. This is a very useful system that has been followed up in Australia, New Zealand, and Switzerland, where there is a compensation for the injuries caused. This encourages the doctors to come forward when an error has occurred, and it helps the patient and the doctors have a genuine conversation, and it helps to improve the entire network. So the compensation is given according to the level of injury. Although the patient can go for this no-fault system, they still have a right to file a legal lawsuit as well. In Sri Lanka, with time, although we do not have a current epidemic like the Western world, with time, AI and social media, we may soon face that problem. So if we want this no-fault system in practice, we will have to restructure our Agrahara system, where there is a higher funding from us as well as the health ministry. Challenges in medical negligence. The judgment of negligence, when the court hears the negligent claim, the opinion of qualified expert is very important. He may or may not agree with the standard of care or the injuries caused to the patient. Patient's biological status. Not every patient reacts the same way to every medication. So we do not know how the biology of the patients or the problems, the underlying comorbidities of the patient will respond to the treatment. And it's difficult to say, what if this medical negligence has not occurred? How would the patient be? So we are actually looking into the unknown to answer this. AI-driven diagnosis. Day before yesterday, I read in one of the Indian newspaper where a man had diagnosed himself with rhabdomyolysis. For the previous 2 weeks, he has done some exercise and he felt sore muscles and he was weak. So he entered his symptoms into the AI and got a diagnosis of rhabdomyolysis. And it even gave him advice to seek medical attention immediately. So trusting the AI, he went to the hospital and they ran some blood investigations and found that he did have rhabdomyolysis. So when we see patients coming like this, our first thought is to argue with them and say, I cannot treat based on your Google diagnosis. So in future, we may not only be battling with the patient, family, and the laws, but we may have to battle with the AI as well. And finally, medical negligence is a long legal battle. It causes physical and mental exhaustion and financial loss, not only for the patient and family, but also for the healthcare professional. Possibly the only people who would benefit from this long legal battles are the lawyers. So as a take-home message, I would like everyone to exercise a proper duty of care, which is in par with the standard of care approved. Best thing is to do a proper examination, get a proper history, examination, and document those findings. If you're not available, the next doctor will benefit from going through your notes as well and establish a very good rapport with the patient and family. This will prevent some of the medical lawsuits filed. In case you're not sure of your findings or you're not the expertise to manage such a case, it is always best to refer them to relevant specialists. And updating knowledge with latest clinical trials and guidelines is the best way to treat patients and also safeguard us from the medical malpractices. Thank you. I'd like to acknowledge my team members, my consultants who are not here at the moment. Dr. Vimlasiri Uluvattage sir, Dr. Tilak Sirisena sir, my co-senior registrars and registrars. And special acknowledgement to my attorney at law, Mrs. Amali Mallavaraju, who gave me all the documents, legal documents for me to prepare this presentation. I would also like to thank the CCP for giving me this opportunity. Thank you.
Thank you for that lecture. Is I think we want to ask the question.
Do you know any legal help? Is it officially available to the Minister of Health for the Minister of Health doctors? Is there any such help?
Generally, since we are government servants, man, there will be an Attorney General available for us. But if the cases are filed outside the hospital, like in private sector, we have to get a lawyer by ourselves.
Any other questions? Do they reimburse if somebody have a medical indemnity from the Ministry of Health? I not explore this.
I'm sorry, sir.
If you have, want to have some medical indemnity, so somebody sues you, that will be covered as not being visited.
So currently we don't have that system. So that's why we need to restructure our Agrahara, where there'll be funding from both the doctor's side and from the ministry as well. So currently, though, even the Gampahar case side has been filed against the District General Hospital, Gampahar. But we are not sure who will pay for that because the lawsuit includes multiple people, including the consultant, the interns, and the nursing officers as well. So who takes the share, how they are going to separate, we don't know, sir.
Are there instances in our government system where there have been, negligence and there have been claims of damage and then they have to be where
that has not been disclosed. Like most of these cases are handled by the senior most lawyers in the country, sir. So they do not disclose that publicly. Even the legal cases that I was going through, only the verdict is available, but what happened after that is not available, sir.
Any other questions?
Yeah. Thank you for that very timely topic. This topic has always been very timely for any time. And in the medical boards, so most of these are the examples that just happen outside the medical board. What do you experience? What are the commonly happening negligence? Some examples of negligence in the medical boards?
In the medical ward is what I observe from my practice is not having a not having a good communication, sir. So patients are not happy. They don't know what they are getting. Even the family, they do not know what the mother or father is being treated for. So that unhappiness has led to this, most of these arguments between the health sector and the patient families. If you can communicate effectively, I think in our system, unlike the Western world where everything is documentation, we have, I think the patient understands our situation as well because the wards are crowded and we are unable to speak to them on time. But communicating will go a long way, sir. That's going through all the documentation. I found that the consent was not obtained properly and there was a poor communication between the health staff and the family, sir. Procedure-wise, there is no percentage of how many cases are documented, but the surgical procedures, there are a lot of cases filed, sir. Like these wrong side biopsies, wrong limb amputated.
One of the common sort of negligences that I see in the medical boards is that when the patients are admitted, sometimes they are recommended maybe omeprazole for BD, then indefinitely that is being continued, even when the diagnosis is something else, and when the patient is not having something else. domperidone 10 milligram TDF, something like that. Even sometimes when we start some antibiotics, sometimes microbiologists give some different opinion. So in the medical words, we are continuing what we have already started plus the microbiologist opinion. So when I see the drug chart daily, I see that lot of things that making mistakes is in our nature as humans, that is true, but a lot of things, but they don't come to the level of lawsuits. But I hope that unnecessarily giving medications for a long period of time, at least without some clinical diagnosis, would be something.
Yes.
We don't know the exact, we know that giving something like that, but it may be too early, something like that without indication might do some lead to complications and other things. So that is a very common thing I see.
Thank you, sir.
Sir, that's a really fine topic. I have been to several inquiries. Actually, the appointed board to inquire several compensation. I think, Professor, you have some duty to, to educate, see the medical curriculum regarding these things also. They came under this report or whatever, they want money, then the minister appoints a committee, the two consultants, in the two cases, and we gave our recommendation. I don't know after that what will happen. Maybe the ministry go through the attorney and then decide. Compensation, I don't know how it happens. Now, with the insurance companies and they are having now set of lawyers. If you go in other countries, when you travel from the airport to your hotel, you see the billboards saying that you get your compensation. Most of the parties get this lawsuits. So that type of lawyers are also coming up. And the insurance companies, they come and maybe you have seen in private sector, they come and offer you this indemnity covers the different wages. So I think most of the consultants in the private sector, they have got it. So in the government sector also, I think we should be having some knowledge about these things. Some education about the low things. They are not much aware of those things. So if you don't have any proper education on the law, that is not an excuse to get the information. So that means it's time to support that also. Thanks very much. It's a very good topic.
Thank
And
you,
nice
sir.
presentation.
Thank you, sir. The other thing, sir, when we want to get the restructure the Agrahara, the funding should come from doctors, which is a percentage of the salary that's going to go into Agrahara. So if we have a national audit, we can like tell the other general body that there is a significant number of medical negligence occurring every year. So we can convince them to like accept this Agrahara restructuring as well.
So in the interest of time and maybe any questions, let us thank the for this wonderful talk.
Thank you, sir.